And welcome to the Dr. Bob Show. We'll be spending most of this show talking about head and neck cancers. Cancers of the ears, nose, throat, the back of the throat, the back of the nose, the sinuses. They're getting more common, but there's good news. They're changing the cause. The cause seems to be different now, but the treatment is getting to be better and better. What are the early signs? What can we do to prevent? A lot of information. My guest is Dr. Nick Panella. Dr. Panella is a board-certified ear, nose, and throat doctor, and he deals with head and neck cancer every single day. Hello, I'm Dr. Robert Overholt. I'll be your host for the next 30 minutes on the Dr. Bob Show. Later on, we'll be talking about that old common problem, how do we stop snoring? A lot of information that may help you on that issue. And why do I always have a runny nose? Is there a cause? Well, there's cause and treatment. You'll want to stay tuned. We're talking with Dr. Nick Panella, board-certified ear, nose, and throat doctor, and we're talking about head and neck cancers. Nick, welcome to the Dr. Bob Show.
Thanks, Dr. Bob. Appreciate you having me on.
How common are head and neck cancers? I don't have a feel for that.
Yeah, it's a slippery one in that way. So it's not common like migraine headache or allergies, but we see nationally about 60,000 cases a year. So it's one of those things, and this just gives a frame of reference because sometimes those numbers aren't that helpful. If I tell somebody, let's say we're sitting down, we're having a discussion, we say, hey, we're concerned you might have a cancer in this area. A lot of the time, somebody will say, you know what, I know so-and-so that's had that, or my uncle has had that. So it's common enough that we don't need to ignore it, but it's not so common that statistically that we're all gonna get it. It's something that we wanna know about and we wanna be aware about. But it's one of those things that is not as common as some of the other stuff that we deal with.
When we say head and neck cancers, what locations are we really talking about?
So it's a bit of a confusing term. It includes kind of from the collarbone up, but we don't usually include brain cancer in that group or eye cancers in that group. So we're really talking about the throat, the jaw, the tongue, the tonsils, even the sinuses and the salivary glands.
So there's really a lot is covered. Is it like most cancers, if you find it early, the treatment is better?
Big time, big time. Early detection is key in all the cancers that we treat in the head and neck.
So let's pick a type of cancer and let's talk about what some of the symptoms are. For instance, in the throat, when you open the mouth and when you look in the mouth, what type cancers could be there?
So it's a funny world that we deal with here because it's really one main type of cancer, but it can be on different types of tissue. So it's something called a squamous cell carcinoma. Squamous is that word that means like the lining of the skin. We have those same cells that line our tongue, that line our cheeks, that line the whole back of our swallowing cavity and our breathing tube. And so mostly what we deal with is squamous cell carcinomas, and that could be the tongue. Sometimes that's a lump on the tongue that bleeds and looks kind of angry, but doesn't go away with an antibiotic, and it's not from an irritated spot on the tooth. It's usually lumps and bumps that you can physically see and feel when you're talking about in the mouth and in the oral cavity.
Does it get bigger and bigger and bigger until somebody figures out something's wrong here?
One of the things I like to tell people, just as a rule of thumb, is that cancer has one good thing about it, and that's that its behavior is pretty predictable. So if you've got something that's growing and shrinking and kind of goes away and then maybe it comes back, that's not behavior that we think very much about with cancer. Cancer tends to grow and grow and grow and get bigger and bigger and bigger and more problematic. And so that's one of those behaviors that if you're talking to your doctor and you're saying, hey, I got this spot on my tongue, it gets bigger and bigger and bigger, that ought to be a red flag for people.
So does the dentist help? Does a dentist find a lot of oral cavity cancers?
Absolutely. I get referrals almost every day from dentists or other oral surgeons or periodontists that have looked in somebody's mouth and said, hey, this spot just doesn't look quite right. It's kind of irritated. It doesn't look like it's related to a tooth. And so, yes, we get a lot of referrals for that. And a lot of dentists have saved a lot of lives by finding spots either in the tongue or the mouth or the back of the throat.
It's good that as a dentist, you would not be just looking at teeth. You're
That's right.
looking at the health of the entire mouth. So if you see a cancer, if you find a cancer on the base of the tongue, what do you do for it?
So we've kind of got a whole stepwise process depending on what we're dealing with. So let's say somebody comes in with the back of the tongue or the tonsil area that's swollen or lumpy. Usually they'll see an ENT. A lot of times we'll look in the mouth just with popsicle sticks and a headlight like your normal doctor would. Sometimes we'll do kind of uncomfortable things like put our finger back there and try to feel it, which can be a little gaggy but can also be important. And then we also have...
What would it feel like?
To feel it, it's more firm. So cancer tissue tends to be tissue that's growing outside of the normal control of the body. So instead of feeling soft and spongy like tongue muscle or tonsil tissue, it feels kind of firm, like there might be almost something hard there buried under the skin. Yeah, exactly.
And when you find that, what do you do for it?
So depending on where it is, we want to get a sample of it. So sometimes we'll get CAT scans and that kind of stuff can be helpful to get a better picture. But the reality is we can't tell somebody you've got cancer or you don't have cancer until we have a piece of that tissue looked at by a pathologist. And the pathologists are the microscope doctors. Those are the guys that look at it under the microscope, look at the slides, and they can say, these cells are abnormal, and they can tell us exactly what it is.
And then you can design the type of treatment according to what your x-rays and exam and the type of, there are different types of squamous cell, different degrees, class 1, 2, 3, and like there is in everything?
Yeah, like with all medical things, it seems like we've made it more complicated than it maybe needs to be. But yes, we've got all different stages of symptoms. Some of them talk about what it looks like under the microscope and how aggressive it is in that case. Some of them talk about how big the tumor is. But really what I like to do is just kind of break it down into really simple stuff. Early stage where we say, hey, this is just on your tonsil and that's it. Kind of medium stage where we say, hey, this may be in your tonsil and some lymph nodes around it. And then kind of the later stages where we say, this looks like it's spread to other parts of the body. And so the kind of simplifying that breakdown, I think, makes it a little easier for people to kind of get their minds around.
Are most of these treated with chemotherapy, cancer drugs, or with radiation, X-ray, or with surgical excision? How do you make that decision?
Yeah, and I don't know. I mean, I wish there was a tidy answer because it seems like it's a moving target. Some of these surgeries that we used to treat almost exclusively with chemo and radiation, we're now kind of backing off some of that and saying, hey, this actually is a surgery that probably people can do pretty well with, and if you do the surgery correctly, we see nice outcomes, and we can maybe avoid chemo and radiation. And so the ever-changing paradigm in cancer treatment is that you always want to have conversations among the different specialists. So if somebody's sent to me for surgery, I will often also send that patient to see a chemo doctor and a radiation doctor so we can have this multidisciplinary conversation. Okay, what do we think is the best treatment here? What do we think is the best treatment here? Because it's complicated, and I'm not sure that we always know exactly what to do, and so sometimes we'll let the patient decide, okay, are you nervous about the idea of chemo? Are you nervous about the idea of surgery? Where would you be more comfortable? Because sometimes the patient deciding is the best way to do it.
Yeah, and we're getting that more that way in all facets of medicine,
right.
Shared decisions.
Sure, yeah.
And you look and say, well, you're not going to ask the patient what kind of treatment they really want, but you give them the options and you work together with that. The causes that we have of squamous cell cancers in the ear, nose, and throat area, is it smoking? Is it trauma? Is it stuff that we're eating? What is the cause?
So it's interesting. This is the big paradigm shift. This is why we're seeing this in the news all of a sudden. This is a cancer that was kind of not talked about a lot. Traditionally, people that get throat cancer or head and neck cancer, we thought of as people that had a smoking history, usually a pretty extensive smoking history, and almost always a pretty heavy alcohol history. And so what we used to kind of call the smoker-drinker type cancers would appear in the voice box and the tongue and in the cheeks. And those tumors, we actually are seeing less and less of. The population is being educated about tobacco abuse, and we're doing better about talking to patients about tobacco use. And so that's decreasing, but at the same time, we're now seeing this large increase in patients that have no smoking history, no drinking history, but have cancers related to HPV virus.
So HPV virus, is that common?
HPV virus is extremely common.
And that's what we're going to be talking about when we come back. HPV, human papillomavirus, very, very common, and now is causing problems with cancer of the throat and other areas. You're going to want to stay tuned. We're talking with Dr. Nick Panella, board certified ear, nose, and throat doctor. We're talking about head and neck cancers. We've talked about how they're very common. They're squamous cell usually. That's a different type of cell in the throat. The treatment is very good. The cause, which we used to think of as smoking and alcohol type situation, is now thought to be changing toward a type of virus. That virus is called what, Dick?
It's HPV, or human papillomavirus.
That's a big, long name.
That's right.
This virus has been the cause of ladies having cervical cancer, cancer of the cervix around the uterus. But now we're getting to see it in the ear, nose, the throat area. So tell me about what you see with human papillomavirus type cancers in the throat.
Sure. So it's a really common virus, and we didn't know that until we started with some of these fancier ways of testing for viral DNA. But we know that about 90 to 95% of the United States population is going to have had or be exposed to HPV at some point. So what we really want to do is make sure that people don't think of this as, you know, some nasty thing that only certain people can get, because it's really, really common. Most of us have been exposed to or have this virus at some point in our lives. And so it's a virus that goes into cells, and it doesn't cause a lot of trouble a lot of the time. The frustrating thing is that sometimes it goes into those cells and it creates a little bit of chaos in the way they divide. Sometimes that shows itself as a little wart. Sometimes that shows itself as a cancer, and that behavior is very unpredictable. So we've got to be vigilant, knowing that this virus is around. A lot of people have been exposed to it, and we just have to be cautious about what that might mean in the future for people, both female reproductive tract cancers, but also for people in their oral cavity too.
So men and women both can get the HPV virus, and it can be in the throat and can cause a type of cancer. Is it the same? Does it change the squamous cells into a squamous cell cancer?
It does. That's exactly right.
So how does it present? What do you see? What do you find when somebody comes in with that?
So the HPV related cancers are interesting because they only treat, or just, I shouldn't say only in medicine, obviously you can very rarely say always, but almost always they're either in the tonsils or the very back part of the tongue, what we call the base of tongue. That's the part you can't see when you look in the mirror and look at your tongue. And so what happens in those areas is you end up usually having a small lump, and that's the cancer cells that are starting to grow. And we usually find these cancers when they've already jumped to the lymph nodes of the neck. We call that cervical metastasis, which just means that the cancer cells have gotten into the lymphatic system has done its job and has filtered them out and caught them there in the neck. And so most people, when we are making this diagnosis, already have some cancer cells in the lymph nodes of the neck.
So if it's spread into the lymphatic system, the treatment changes dramatically than if it's just in a local area. So who's going to treat that type if it's spread a little bit into the lymph nodes?
Sure. So it depends on what we're seeing. And again, like we'd said earlier, it's very patient specific. But nowadays, we've got new ways to get into the back of the throat, to get back to the back of the tongue, and do that with surgery. And so we know that these tumors are less aggressive than the ones that were related to smoking. And so now we're trying to figure out, how can we best treat these patients? We know that they tend to be very survivable type of cancers. How can we treat patients in a way that's least harmful? It's least likely to disrupt your speech for the rest of your life, least likely to cause you to have dry mouth for the rest of your life. And so what we're trying to do now is always walk that balance between treating this tumor, making it go away, making sure our patients live long, healthy lives and die of something totally unrelated many years later. But what we want to do is do that without poisoning them so much with all these extra treatments. And so what you were saying earlier, a lot of times now that means that they're getting a surgery, and sometimes only a surgery. So that may be a surgery to remove the tumor and a surgery to remove the lymph nodes.
So if the lesion is in the back of the tongue or in the tonsillar area right there. What type of instrument do you use? Do you use endoscopic type surgery? Do you go under the tissue and find your way there? Tell me about that surgery.
So it's an interesting surgery because it's developed a lot over the last, it's really recent, 10, 15, 20 years that these surgeries went from something that you read about in a journal to something we see every day in practice, which is, it used to be that to get back there, you had to actually do something called a mandibular split, where you cut the jawbone in half, and it does sound barbaric, and it certainly was, and you had to go back that way. Now we go through the mouth. We say, hey, there's an existing opening there. Why not use that? And using different tools, sometimes a robot's used, a surgical robot. Sometimes a laser's used. Sometimes endoscopes, which are cameras that go down into the hole, are used. But it lets the surgeon see what we're doing back there. So we can say, hey, this isn't just some blind area, and we can visualize the tumor and get around the tumor so that we know we got all of it out.
So are you pretty good at, and by you I mean the ENT doctors, are you good at finding how localized it is, removing that, and not having to remove a whole lot of extra tissue?
So that's where we lean hard on our colleagues in the radiology world and in the imaging world, so they can say, hey, we think the tumor is here, we think it's pretty well confined, so that when you go into the operating room, you're not surprised. So you say, oh yeah, this is kind of what the CT scan showed me. That way you can take the tumor, a little bit of tissue around it, which we call a margin, because that's important to know that we got all of it, but you don't have to take everything. You don't have to take all the other important structures. You don't have to take out pieces of tongue muscle or other pieces of the palate that you might otherwise need. You just take the minimum necessary to clear that tumor and get all the cancer out.
So is the surgery and the treatment of the HPV oral cancers good results?
Yeah, it's one of the exciting things in head and neck cancer is that these are diseases that we used to think of as having a really poor outcome. And I think we've seen this on TV, really disfiguring surgeries and people that just don't have good long-term survival. With the HPV-related cancers, we still want to take them seriously. We don't want to, forget that this is still something that can be very dangerous, but we see the outcomes are much, much better. These tumors respond better to chemo, they respond better to radiation, they respond better to surgery. And so even though these are scary things to be faced with, we know that most of our patients that are being diagnosed with the HPV-related cancers are going to go on and live a long, healthy life of, and not have to worry about this.
So what should we, as the lay public, the non-medical public, what should we do to help diagnose a type of cancer that's in the throat? Who do we rely on? Our dentist or ourselves, or brushing our teeth, or gargling, or what do we do? How do we do it?
Yeah, so unfortunately we don't see much improvement with oral hygiene. It's not one of those things that's about keeping your mouth clean or keeping, using a certain type of mouthwash. It's really about detection. So it's not ignoring something that you feel, I feel a little unsettled about this. So that would be, I feel like one side of my throat is more swollen. I feel like I can't swallow on one side. I feel like I've got this lump on one side that hasn't shrunk. Maybe your primary gives you a round of antibiotics, hoping it could be strep throat or something like that, and it doesn't get better. Use your intuition. These things, again, remember that behavior. They don't get better. And so if you've got any kind of problem in the back of your throat or in your neck that just seems to be steadily worsening, that's something you need to talk to a doctor about.
I think that's the big key. And
yeah,
we always say, listen to your body. It will tell you what's going on.
That's right, yeah.
So if something keeps getting bigger or more aggravating, see your doctor about it. Nick Panella, you're a great teacher. We could have talked on this for hours and hours, and you do such a great job of making us know that this is a very treatable form of cancer. Find it early, get it treated, know that the results are really very, very good. So let's go get it taken care of.
Thank you. I appreciate you having me. I do.
It's a pleasure. Thank you. Great show. If you have a lump that's getting bigger or something just doesn't feel right, talk to your doctor about it. Talk to your dentist about it. Find out what it is and get it taken care of. And now you're going to want to stay tuned. We're going to be talking about that old problem, snoring. Is there anything new that we can do to stop snoring? Well, there really is. And why do I always have a runny nose? It could be from a lot of different causes. Treatment's pretty good. You'll want to stay tuned. I want to thank Dr. Nick Panella. Wonderful discussion on head and neck cancers, if you feel that little bump that's getting bigger, be sure you get it taken care of. Now, question from you, the viewer, that I think will be important to your health. Question number 1, Dr. Bob, how can I get my husband to quit snoring? Well, it's a very, very common thing, snoring. And the more we talk to people, the more we realize that snoring is a very common thing to happen. The biggest problem is it can interfere with the health of people that are in the bed. So let's talk about snoring. 3 things that cause snoring: bad nose, bad throat, bad belly. If the nose is crooked or swollen because of allergies or other reasons, then you have to pull to breathe because you can't breathe through your nose. When that happens, we will snore. Bad throat. The back of the throat, where the uvula is, where the soft palate is, if it becomes too close to the back of the throat, then we'll begin to snore just because of the anatomy is there. So bad nose, we have to get that fixed. Bad throat, we have to get that fixed. Bad belly. If somebody is too overweight, the diaphragm has to move down and you have to pull on that diaphragm in order to breathe. So those 3 things that cause snoring: bad nose, bad throat, bad belly. So what are some of the things that we can do to stop that snoring? Number 1, be sure we sleep on the side. So if you're sleeping on the side, you frequently will not snore. When you sleep on your back, you frequently will snore. Be sure before you go to bed that you don't use alcohol or that your sleeping pills or medications are not making it where you snore. If you're smoking, stop smoking. That relaxes the muscles that allow us to snore more. So changes in position, losing weight, getting the nose fixed, all those things will help you stop snoring. Now know that when you snore, you can actually stop breathing, and that's called obstructive sleep apnea. That can lead to diabetes, obesity, high blood pressure, headaches in the morning. So not snoring is an important part of your health. If you're snoring, your spouse is snoring, be sure you get that checked. Question number 2. Dr. Bob, what's the best way to get rid of a drippy nose? Well, the nose will really lead your life astray. If it runs a lot, you have to wipe your nose, and that's embarrassing. Sometimes you have to sniff a lot if your nose runs. So what causes the nose to run frequently? Well, there are lots of different things. The nose is an air conditioner. It takes the air out here, gets it ready for the lungs. It has to humidify the air by secreting mucus. And so it's normal to have mucus in the nose. That can be watery or that can be thick. And there are blood vessels in the nose that when we breathe, the air goes over those blood vessels and will give us some warmth. So the things that can cause a drippy or runny nose could be somebody's got underlying allergy. The allergy usually the person knows if it's a seasonal allergy, but some people have allergy problems all the time, and they've got sneezing and congestion and drainage and a drippy nose. Some people have food allergies. Every time they eat food, they seem to get a runny nose. Well, that's not food allergy. If there's one specific food that's causing problem, then that's what we call food allergy. So know that eating food can stimulate the nerve in the nose that causes a runny nose. There's a great treatment for that. It's called Atrovent nasal spray. It's a nasal spray that blocks the nerve endings in the nose that cause a runny nose. So Atrovent generic nasal spray, 2 sprays each nostril, 3 times a day for 4 days. And after those 4 days, then you just try it in the morning and see how long it lasts. You'll be shocked at how well Atrovent nasal spray will stop that runny nose if you've ruled out other causes. That's all the time that we have for this show. Remember Those 4 things that we like. Number 1 is exercise. Be sure that exercise is part of your life. It will help you maintain the weight that you want to have. It will cut down on anxiety. It will make you feel better. You'll have runner's high and you'll be happier. So exercise is an important part of staying healthy at all times. Be sure that you're getting 7.5 hours sleep. When people don't sleep well, they're irritable, they're in a fog. They frequently don't perform as well. They're not happier. Always know if somebody's had a good night's sleep and they're whistling, and it's always good to be around those people. Be sure that you eat properly. Be sure that when you eat, it's a diet of fruit and fiber. A Mediterranean diet. If you want to Google something, follow a Mediterranean diet, and it will tell you the types of foods you can have. But for breakfast, we can have fruits, we can have cereal, skim milk. You ought to have the fruit as part of your breakfast, but also other parts of the day. And as the day goes on, think about the volume of the food that you're eating. You want to eat less volume and better types of food. So no fatty, fried, greasy foods, less meat, more chicken, more fish. You are what you eat, and know that organizing your eating will make you healthier. And most of all, what do we like in the Dr. Bob Show? It's that laughter in your life. Find that person that you love. Tell funny stories. Read funny stories. Read books that make you laugh. Watch television that makes you laugh. Because the happier you are and the more you laugh, the healthier you will be.